Hey, how are you? Oh, can you see
I'm
me
doing
okay?
well. How are you?
All right, let me see. Is that right? Boop, boop, boop. Can you see me? Oh, there we go. It's in line. Let me
Yes.
unplug this. How's it going?
Pretty good. How have you been?
Doing all right. How are you doing?
Doing well. Just busy. Busy's good. Tell
Long
me
time
what's
no
happening.
see. It's been about 6 months, right?
Yeah, yeah.
Yeah.
Tell me what can I help you?
Oh yeah. Everything's a little. There's a lot going on. Um,
Okay.
there's a lot going on. But the first thing I want to know is, okay, remember, we're pretty new together. Like, we haven't been together a long time, okay? And one of the first times that we talked, I asked you, why the psychosis diagnosis. And you
Yes.
said that you don't know me very well. We need to talk. You need to get to know me a little bit better, and then we can talk about that. I want to know why I had the psychosis diagnosis.
Okay. I think so. Initially, when you were, so I know you were hospitalized on a unit in 2020, and then we met in 2024,
Mm-hmm.
and I think there was some issue, like suspected paranoia that you were having, um, that kind of led to that diagnosis that was
Um,
given in.
Yeah, but who gave that to me? Because I'm 50 right now. I'm gonna be 52, or what is it? Well, I am 52. May, June, all right, or 51, whatever. I'm 51 or 52. But anyway, yeah, I haven't had a psychosis diagnosis ever. I've been through the worst places. Seen the worst. I've seen everybody. Never had a
Yeah.
psychosis diagnosis, ever. And then it's the first thing I brought up to you when we talked. I said, why
Yeah.
the psychosis diagnosis? Can we change that? Like, because I know that makes a big dramatic impact on my record. And
Yeah.
yeah, and then
Um,
you're saying there's paranoia and everything, but look, I don't talk to anybody. You have it in your file. I don't talk to anybody ever. All I talk to is my girlfriend. I don't talk to any neighbors, anybody. So what was going on? I was hospitalized twice for complaining. Okay, I was saying, hey, 311, 911 grievances. I told you about that. I didn't do anything psychotic. I didn't beat anyone. I didn't threaten anybody. All I did was go through the right channels when I found out that I was being harassed. The psychosis diagnosis, I don't know if it's from the lady from the place or from the doctor, but when I complained, I didn't even know that they could put me in the hospital, but she could, and she did. Okay, and then the first time I had a psychosis diagnosis. If I don't talk to them, if I don't talk to any of my neighbors, if I don't talk to anybody, a psychosis diagnosis is extremely serious.
yeah.
So why I want a full explanation on why it's maintained and who gave it to me and for what reasons.
It looks like it was given to you in 2020. Um, and it was given by just the hospital in 2020, and that's what carried through.
Okay,
I
so
mean, I know
the
that
the
it,
initial. So there was no violence. The second time was the fight. Okay, so I can see if you put it in for the violence, but that was not the case. Okay,
right.
on this case, I was hospitalized for complaining, for saying people are bothering me, people are banging on my walls, people will not leave me alone. That's all I said, and I wrote
Yeah.
grievances on it. Called 311 about it. I called 911. I talked to the building manager multiple times. I mean, I did everything that you're supposed to do,
Right.
and I got a psychosis diagnosis, and you backed it. I don't understand. You're
Yeah. I
backing
mean,
this.
need to, I'm not going to write that you're actively psychotic. This is just something from the past that was carried through. It will be on your chart just because of
No, but
prior.
that's the diagnosis for the medication you gave me.
Right.
It's
So
for
that's
psychosis.
from
For
previous. I
the
mean,
Yeah, previously, and the same lady, the counselor, she didn't tell me she was the head of psychosis. She just told me she was like a college kid that just wants to hear me vent. Yeah, she turns out to be Maggie Malone was the head of psychosis for Masonic.
yes. So she was somebody you were seeing before, and that's like a history. You have a history of it, but
No, I have
I'm
no history of psychosis
please
ever.
don't. Can I
No,
finish?
I'm not crazy. I'm not even loud. I'm just saying I have no
Can I
psychosis.
finish? So
Of course.
you're interrupting.
Oh, I'm sorry. Go ahead.
It's all right. That was so this is the case. I feel like I've repeated this was a diagnosis given to you
Oh,
before. I'm not
I'm
saying that you
sorry.
have active psychosis. I'm not saying this is an active diagnosis.
I'll
If you
I'll calm
actually
down.
have more,
I'm sorry if
can
I
I?
alarmed you.
I'm not finished.
Okay.
And yes, you were taking medication for that prior indication. However, I cannot force you to take medications. If you do not agree with your diagnosis, that's your right.
Mm-hmm.
And if you do not agree with the indication to take medication, that is also your right.
Okay.
I will not continue to prescribe medications if you feel that it is not indicated for a diagnosis you do not agree with. Okay.
Can I speak or?
Yes.
Okay.
Go ahead.
No, I agreed. And that was why the first thing I told you, the first time we ever talked was what was up with the psychosis diagnosis. I saw immediately it was on there, and I asked you about it, and I was why was this put on there? Because it's the diagnosis. It's the exact reason why this counselor came to me. It's the same reason why you prescribed the medications that you gave to me, was because of psychosis. There was no, I mean, I don't, and you're saying only because paranoid. And right now, like, I don't even see myself getting loud. Like you were saying, calm down, and all this stuff.
I did not say calm down.
Or let me talk. And okay, well, you know what I mean. It was this gaining control because I was out of control. But I don't see I was out of control.
I said let me finish because of interruptions.
Okay, I'm sorry.
That's all right.
Okay, if you would have known me for a long time, you would know that's how I do. I mean, if you talked to me a long time, I always did that. Correct? I always talk loud. I always talk fast. I always interrupt. It's no different than I've ever done before, right?
Sure, but it's I'm just.
I didn't mean to be rude. I'm just saying. Yeah, it is. I didn't understand the whole psychosis diagnosis. So, you're saying it's because I got conspiracy theories.
That was what was reported. You've never said that to me, so I can't. You're right. I cannot diagnose you with that because you've never
So the lady gave me that psychosis, or the hospital.
Yeah,
Who gave it to me? The lady or the hospital?
Well, it's the hospital system. It looks like Maggie Malone was the one who first evaluated you, so that was a diagnosis put on there.
Oh, Maggie. No. See, I only got that Maggie Malone was after the hospitalizations, Dr. Shi.
Yeah.
So that she wasn't. Yeah, she didn't give me that note because I only started talking to her after the psychosis diagnosis. So that's not accurate.
Okay, well, I'm going based on the chart. I'm not making things up.
Oh, no, I understand that, but that's not, I only saw her after the hospitalization. So the psychosis diagnosis was on there before I talked to Maggie.
She has a note from October 21st, 2020.
Okay.
And it is her, and the encounter diagnosis is paranoid delusion. I'm just telling you objectively what the note says, okay? I'm not...
No, I understand, but I'm telling you what happened. The notes are a little screwy, but this is what happened. So I had the psychosis diagnosis before that. That's why she was assigned to me, okay? She's the head of psychosis. She never told me she was the head of psychosis. She just told me, I was like my girlfriend, and I always thought, vent. You have no one to talk to, talk. So I would tell her about the curtains, and I was opening up. And then I suspected that she was using it against me, and I did. I started reading some of the notes, and then I immediately cut it off. But the psychosis diagnosis was perfectly ingrained because of my speech, because I talked to you about the curtains, I talked to her about the curtains, nothing erratic. It was just a means for me to vent, and I don't trust people anymore because the people that I'm supposed to talk to are weaponizing it against me, and then you're fabricating psychosis diagnosis for what's happening. I'm not psychotic. I don't talk to anybody. I've never been diagnosed psychotic. I've been in all these institutions. No one's ever said psychotic.
Yeah, I agree with you, and I hear your frustration, so I'm sorry that
Which
happened.
means a big deal. Psychotic is everything in society.
Yes.
And medications and treatments.
So I guess going forward, I'm wondering, do you want to stop the medication that you're on?
Please.
I
And also, I have another concern about the medications, okay? I've done research, and gabapentin and erisipral mixed together with people on psychosis and heavy weed use is a deadly cocktail. I've done research. I can forward you the research. I've done multiple, and I had to do real digging, but I found it. It's not good for me. Gabapentin and erisipral together is a bad combination. When you mix it with marijuana, it's an accelerant. And my health insurance, everybody knows I smoke heavy weed. I've never denied that. That's the first thing you did. Yeah, I smoke weed. How much? A lot. Yeah, and that's a lot. And then you gave me gabapentin, which is that mixed with weed is deadly.
So we can stop all your medications. That's totally fine. I can take.
No, I'm not trying to be disrespectful. I'm not trying to. I just did research, and look, Dr. Shi, when I was on the medication, my low blood pressure, low white blood cells, obesity, ED, depression, you name it, everything under the sun. I was dying. Then I take myself off it, and my blood works perfect. Everything is fine. So it's not my imagination.
No, I'm not saying it is. I'm just offering you. So I'm asking going forward. I respect your decision. Would you like to stop your medications?
Will I be in trouble?
You will not be in trouble.
If I stop my medication, I'll lose my housing. That's what they're trying to do right now. They're trying to take my housing. This is the whole reason. People are coming at me. I got the government coming at me. I got the police coming at me. I got all types of people coming at me about.
Okay, your choice.
I would love to stop taking the medication, but the only thing is, if I stop taking the medication, that's what I always thought. I always thought it was my choice, because it was always like my other doctors. It always made it perceived like it was my choice, and that's why it's really alarming to me that they're saying everything's fine. I'm doing nothing, but as soon as they say I mentioned one time that I'm not taking my medication online, and I got police coming to my door. I got the police, the landlady trying to take my apartment. One comment on social media, what they even shouldn't listen. And then I got, all these people accusing me of not taking my medication. Okay?
Okay, I can't control the legal.
But you're my doctor, and I'm just telling you the things that are bothering me.
Absolutely, but I'm just telling you I can't control the legal aspect of those things. I can only control if.
Okay, but it's my housing and my medication is related to my housing. So if you give me something that's calm, I will take. Can you give me something very mild, so I will continue my medication? They don't have to know what I'm taking. I just don't want antipsychotic that's going to lower my blood sugar and kill me. I'm going to do full research on it.
Okay, would you like to continue what you're on now, or would you like to switch?
Absolutely not. This is killing me. I've absolutely done research. It's actually increasing my mortality rate. If you want me to send you the paperwork, I can. I got it all. Yeah. You want to give me a number, I'll forward it to you. But you're a doctor. You should know this. Okay? Yeah, it's not good for me. It's not good for me at all. And not only is it not good for me, but it sheeps you. And I told my doctor before, I said, yeah, I don't take it because it gives me diarrhea and I can't think. I told my doctor before that, Dr. Harris. I was like, yeah, I didn't know it was killing me. I just knew that I couldn't think, and it was really prohibiting me on a lot of things. And so I was like, so she gave me the option, and I didn't. I was like, okay, if it's not my choice, I don't want to take it. You know what I mean? And I stopped for a little while, and then, and then I got back in. I didn't think it was harming, like killing me. And then,
So, Kenneth, we need to come up with a plan. So
okay.
Right now, you don't want to take the abilifying gabapentin.
Yeah, yeah, and I know medication is a prerequisite. If listen, Dr. Shi, if you can talk to my housing and I can continue my housing without the medications, I would like to do that. Because as you know, I never go out anywhere. I never talk to anyone. Why should I be medicated if I'm never in a social situation? All I do is walk my dog.
So can you tell them to reach out to my office?
Who?
That would be the best. The housing people.
Oh, okay. Yeah. Okay. I can. Next time I do, I'll yeah, please.
Let them know to reach out to my office.
Great.
I'm happy to keep going. But right now, we can just discontinue your medications.
But if I do that, I'll lose my housing. I'm part of Catholic Charities, and Catholic Charities, the Department of Aging had a sheet. They said, yeah, if you refuse to take your medication, you will lose your housing. So, yeah.
Do you want to be on
That's well, you're my doctor. You tell me if I take it, I lose my housing. And so I'm saying, give me the bare minimum, something very, so I don't care if it's the placebo. Give me vitamin D. Prescribe me my medication.
That is not the indicator.
All right. What I'm saying is, give me something very mild that's not going to harm me, and I'll continue it. Okay? I'm not anti-medication. You guys know that. I've always taken my medication because I thought you guys were there to help. Okay? But Bella, shh. I'm sorry. No. She's watching dogs. She's not being crazy. She's just watching dogs.
My professional recommendation is to continue what you're on.
Okay.
I'm not going to prescribe you a medication that's not indicated or just for placebo. I'm putting my license on the.
Okay. I don't. You know what I meant? Something very mild, that not placebo, just nothing that's going to harm me. I didn't mean placebo. I just meant something very mild that I can say I'm taking my medication and it's not going to harm me. That's what I want. I'm not trying to. I'm just saying. Yeah.
Abilifying gabapentin are not quote unquote harming you. So I would continue.
With mixed with, yes, it is. I can show you. It's increased my mortality rate. It says gabapentin and erisipral together, mixed with marijuana. If you're 50 and have psychosis, it increases your mortality rate. I've multiple articles online, medical things. It's like the forbidden cocktail.
That's when I recommend my patients stop smoking marijuana, because there is.
But you already knew I smoked marijuana when I told you. The day I told you I smoked marijuana is when you gave me the gabapentin.
It is not contraindicated to smoke marijuana and use these medications. So there is no, it's not a contraindication.
Yeah, I didn't know it was harming me. But I figured you were my doctor. I told you I smoked marijuana heavily. I've never hid it. The Social Security Administration, my doctors, my psychiatrist, the housing, everybody knows I smoke heavy marijuana. And this
So that
medication combined with marijuana, heavy marijuana use is a potential deadly cocktail. And especially with my conditions, I've done the research.
just continue one of the medications that would decrease the risk. But any medication I put you on comes with
Oh, I
risks.
stopped my marijuana. Yeah, I stopped it 2 months ago. I don't smoke marijuana because once I found all this stuff out that it was harming me, and
Okay. So
yeah.
if you want to continue maybe only one of your medications that could help, so the gabapentin could help with anxiety, it helps with sleep. The Abilify also helps with mood and anxiety as
Hmm.
well. So are you having symptoms of depression, anxiety? Do you feel anxious all the time? Are you
No,
depressed?
I'm a little stressed because of what I've been telling you about they won't let me sleep. And like I
Okay.
said, I got police and I got the FBI. Like, it was kind of funny. Like when I started putting it all together, you gave me a 6 months hiatus, and then everybody's tripping on me saying I'm refusing my treatment and I'm not talking to my doctor. I'm like, no, I'm not the one that gave me a 6 months. She gave me a 6 month, and that's right when
Okay.
I told you when I figured it all out and I knew what was going on. That's when you gave me the 6 month, and then everything
So
just went to hell. Like literally, I got a court date coming up. The guys,
okay. So
remember I told you the guy, my neighbor that was bothering me and following me and up the gun on me? Yeah, he's doing it again. He's following me in the dark and like, so I call him a name and he calls the police and I called the police on him 2 times. I've talked to my
okay.
building manager about him 3 times,
Okay.
and I'm the one that has a court date and he's following me. He's the one running into me at the lake.
Okay.
Not me.
So then
Every time I go out, he goes out. So why do I have a restraining order? Why do I have a court date?
if you want to discontinue your medications and there's no indication for
But the,
that, I can if you want to ask the housing the people that you said are up, you can ask them to speak to the office. If we can it does not want to take medication, so please don't have him lose his housing just because he's
yeah,
not taking.
please, can you call them and take care of this as my doctor? Can
You
you
need to
please do
send
that?
me the information so there can be a release of information. So on the portal, it needs to be official on the portal. So
Okay,
you
the
just send
portal for here. Okay, so let me. Okay, I'll remember it. Okay, so give me exactly what I gotta do for the portal for this thing.
Yeah, so on the LiveWell app, there should be something that says send a message to your doctor,
Okay,
provider, and then you can send a direct message. You can attach things to it, like PDFs, or if there's a
okay,
number,
mm-hmm,
and then we'll get back to you in
mm-hmm.
terms of contacting
Okay,
these people, and
okay.
then we can talk and say that you stopped your medications, but
And
that does
don't take
not.
it's Catholic Charities. That's who you need to talk to because this is just this like
So
liaison. If
let me continue.
I'll give you her and Catholic Charities
So
and
stopped his medications, but that should not preclude him from
from
keeping his
getting my
house.
house. That's thank you, because they're
Yeah.
trying to get rid of me because I'm not taking. You know what? I'm like
You're
I'm
not taking.
dying when I'm taking this. I have low blood pressure. I have low white blood cells. I have ED. I have depression. I have anxiety. I don't move. I got obesity. It's like every single bad thing that could happen to me is happening to me on this medication. And it's like and I'm only taking it for anxiety. So you're gonna give me 50 bad side effects for one little thing, and I never leave my house. So why would I need
Yeah.
it?
So, Kenna, do you want to make your next appointment for next
Oh, I'm
month?
sorry. I'm not getting excited. I talk like that. You know that. I'm not being erratic. I'm not yelling. That's how I talk. I'm big. I'm 200
Why
and,
don't we make an appointment to meet next month, okay?
okay.
You want to make it now?
Yeah, go ahead, please. Yeah. Hold on. I'm sorry if I came up. I'm not. Wait a second. Let me see. Okay. So get yeah. No, everything is perfect. I mean, yeah. I accomplished everything that I thought you were gonna give me a resist. I honestly was scared. I honestly was scared that you were gonna hospitalize me. You know, I really thought you were gonna hospitalize me. So I was not dread. I didn't want to contact you before that. I had 6 months. I didn't want to come before that because I didn't want to go to the hospital before I had to. So I got the 6 month, and I'm talking to you now, and yeah. So
Okay.
yeah, give me the info.
Okay. So for next visit, let's see. Are you available Tuesday, July 8th at 1 p.m.?
July 8th at 1 p.m. Yeah, if I'm not in prison for this. which I'm not saying jokingly. I mean, literally, I got a court date coming up, and I can't do any of the paperwork because it's extremely difficult. I have no printers, and I tried, and it's purposely done that way. I got a from the Illinois Supreme Court. I got a restraining order, which is totally irregular. You never get Illinois. Nothing ever starts at the Illinois Supreme Court. Okay, it always starts at the circuit court and lower levels, and then it escalates to the Supreme Court. In my case, I got the Supreme Court giving me this injunction. You know what I mean? And it's just like it's totally fabricated. I've talked to you. I've talked to my. I also have the what is it called? Just so you know, where is that? Oh, it's the APF came out. I have a case manager with them now. And I got Aetna. I got a weekly, or if not a couple times a week. They talk to me, keeping up on my progress on my case, and you know, from the Department of Aging, the APF. So I have a case now with them, and I have so they're keeping in contact. It's open with them, and they're investigating everything that's going on. So I just want to let you be aware of that right now too. So so I'm not trying to hide anything. Yeah, but there's weird stuff. I got this case going on. You know, they're trying to take my housing away. All right, they're trying to take my housing away because, remember all the complaints I had with this people, the building. Remember I was talking to you about the neighbor. Well, when all this has escalated, the police, you know, I saw this guy, which he kept on following me outside, like, you know, and so I say something to him, and I went back and I called the police that day, and I called, but I'm the one getting caught up because all the building backed them up. You know, I never talked to the building, but they're out there saying, yeah, this guy's crazy, and I never talked to them. How could they say that? It's the same reason why they say I got a psychosis. Where do you guys get that? I don't get it. I don't talk to anybody. I never talk to anybody on the phone. I don't talk to anybody in person. I avoid only time I do my dog and my girlfriend. So all these psychotic, I'm so crazy, and everybody's just standing on it that I'm such a crazy person. You're my doctor. Am I crazy?
I do not think you're crazy, Kenneth.
So why are all these people telling the police that if they never see me?
Yeah,
The psychosis diagnosis, all this stuff is all fabricated. It's all fabricated. You're my doctor, and I'm not psychotic. When I go to the doctor, they don't think I'm psychotic either. So psychotic is a serious, serious, serious thing.
It is. So Kenneth, are you available on July 8th at 1 p.m. to talk?
I wrote it down. July 8th at 1 p.m. Let me see. Let me write it down again. July 8th at 1 p.m. July 8th, 1 p.m. I am Dr. Shi. Okay.
Great.
So we're on the same page. I'm so glad. Will you take the psychosis diagnosis off my record, doctor? Because if you don't think so, I don't think so. No, I don't. The only person that thinks so is that lady from the building, and only because I complained so many times and I called the police and I made her life hell because I didn't want, and I asked a room change. And then Maggie, of course, backed it all because I thought it was an open platform. I could vent and get my frustrations out and to speak. And I knew it was weaponized against me, and that's why I dismissed her. I'm like, you know, once I read the notes and how she was making me sound crazy, I said, okay, this girl's not, I'm gonna stop talking to her because she's trying to make me crazy. And that's the reason why I got it is confirmed, because you said that's the reason why I got the psychosis, why it was confirmed, because I'm paranoid about all these. But I told you the same thing. I told you about the curtains and everything, and everything was fine.
Yes.
Everything's fine. So I'm not doing anything different. All I do is walk my dog. I don't talk to anybody but my girlfriend ever. And I got the police at me. I got Department of Aging. I got the landlady and all these people. They're horrible, and they're bothering me. They're pounding on my walls. They're not letting me sleep. You know, it's. You know, and I know, you know, I'm pretty sure what's going on, you know, and it's just like, and it's not anybody's fault, it's the system's fault, you know what I mean? But people are humans, man, and it's like, people are humans, and people that take part, like, you know, with the Nazis, you know, they were executing all those people just because they got told to do so. They were still guilty, and they're still going to hell, you know? That's if you believe that. Yeah. Okay. I'm just sorry I talk. That's what I'm here to do is talk. I haven't talked in 6 months, so of course. And I wasn't too erratic, was I? I wasn't. You know, I wasn't too crazy, right? Don't think that, right?
No.
Okay.
No, you're just expressing your frustration.
Thank you. I don't want you to think that I'm crazy. Okay. So how do I get the psychosis diagnosis off my record?
So it will be on there, unfortunately, since it's on there already for 2020. I can't touch the chart records already. But I can say that you don't have psychosis.
Thank you. I don't think so either. I don't think so either. Okay, so yeah, I'll talk to you next time, and I'll you said just send the phone number of the Catholic Charities and the lady, because but she's in trouble right now because I didn't mean to get her in trouble, but what happened was when the whole thing was going down with the Social Security and the Doge, and I thought my housing was going to be up for jeopardy. She thought because it was all going to get blown open, and so we talked for an hour, and she told me everything that was going on, and I knew it, and she knew I knew it, and she just confirmed everything, and I was like, why me? And it's not just you, it's everybody, you know. And I forgot what I was I lose track, but anyway, yeah, we'll talk again, and yeah, just I don't want any trouble. You know I don't want any trouble.
I agree.
Okay.
I know. But I will talk to you in a month, okay?
All right. Thank you, Dr. Shi.
Bye,
Bye
Kenneth.
bye.